with all these advances in the medical aspects, it's many times we just many focus in the physical aspects and forgetting the other emotional and spiritual elements. And actually, we are not treating illnesses, we are treating people. When people expect for the miracle to happen and it's not happening, how we continue to support them.
This is the Transformational Life Consulting Podcast with Deepa, Grandon, MD, where Christians like you get the practical support and tools you need to build your spiritual, mental, and physical well-being, and to guide you on your journey to health and wholeness based on evidence-based science and God's Word. I am your host, Dr. Deepa Grandon. Welcome back to another episode of Time to Transform, and a warm welcome to those of you joining us for the first time. So today's episode is going to be exploring the idea how health is more than just taking care of physical signs of disease. So we all know that modern medicine has made amazing progress when it comes to diagnostics, medication, technology, and research. But, more and more research is actually showing us that healing is more than just the physical body, right? So factors such as hope, meaning, personal values, feeling supported. And for me personally, it's the relationship with God that influences how people cope with illness, follow treatment plans, and experience their health, especially when they're facing chronic or serious conditions. For example, in 2010, Dr. Tracy Balboni and her colleagues published a study in the medical journal JAMA showing that patients with advanced cancer who felt spiritually supported reported a better quality of life and were less likely to receive aggressive care at the end of life. And then more recently, Dr. Balboni in 2025 did a review in the Permanente journal that confirmed that addressing spiritual concerns is linked with improved well-being and a more person-centered care. Another really well-known researcher in this field is Dr. Harold Koenig, and he has published multiple large reviews demonstrating that spiritual well-being is often associated with lower rates of depression, improved coping, and greater resilience among people living with illness. And when we look at scripture, we see several verses that support the deep dimensions of healing that comes from God. For instance, in Psalm 73:26, it says, "My flesh and my heart may fail, but God is the strength of my heart and my portion forever." And Jeremiah 30:17, "But I will restore to you health and heal your wounds, declares the Lord." Now, when we look at scripture and we look at spirituality per se and the research findings, these findings and reflections, they're not to replace science or medical treatment. Instead, it reminds us that people are more than a diagnosis. When you look at integrative and lifestyle medicine, they do emphasize the importance of habits, stress, relationships, the sources of meaning and spiritual practices. All of these interact with biology to influence health and healing. So in today's conversation, let's take a look at how paying attention to spirituality as part of a whole person approach can actually strengthen that doctor-patient relationship, support healing, and it can also bring greater compassion into medical practice. I'm truly grateful to have Dr. Delgado joining us today, and he's going to help us explore how science and spirituality can work together in healthcare. So Dr. Delgado is a palliative care specialist. He's a professor in the Department of Palliative Rehabilitation and Integrative Medicine at the University of Texas, MD Anderson Cancer Center. He completed his medical school at Universidad Francisco Marroquin in Guatemala, followed by an internal medicine residency at Michael Reese Hospital in Chicago, Illinois. He then pursued a fellowship in geriatric medicine at Beth Israel Deaconess Medical Center, Harvard Medical School in Boston, Massachusetts, and subsequently he completed a clinical and research fellowship in symptom control and palliative care at the University of Texas MD Anderson Center in Houston, Texas. He is also an active leader within the Forum of Latino Professionals in Humanities and Spirituality Special Interest Group of the American Academy of Hospice and Palliative Medicine. In addition, he serves on the board of the Latin American Association of Palliative Care and the Institute for Spirituality and Health at the Texas Medical Center. So Dr. Delgado has published extensively in major peer-reviewed journals on the physical, emotional, spiritual dimensions of the experience of people living with serious illness. He leads and participates in multiple educational initiatives at national and international levels. He has provided high-quality palliative care to patients with advanced cancer and their caregivers. His primary interest includes spirituality, religiosity, and coping strategies among seriously ill population, as well as education and program development in palliative care across a diverse global setting. So thank you so much, Dr. Delgado, for being here at the podcast. Before we start, can you share a little bit about yourself, like what caused you to get interested, especially in spirituality and health, and for your main focus in palliative care?
Absolutely. Thank you very much, Dr. Grandon, for your invitation. And definitely it's an honor to be here with you all and sharing what I really love, what I do every single day in my life. And I believe that definitely the service that we provide to people with advanced illness or serious illness is really a call. It's something that comes, from the higher power, from anything that we believe, but it's a call that sends us to serve people in suffering. And I believe that this is what calls me towards the palliative care area. Definitely, I want to be a doctor since I was a kid. And to save the world in many aspects. But I believe that as we continue to grow and mature and everything, you realize that there's a lot of suffering. And as you will say since the beginning, is that with all these advances in the medical aspects, and many times we just many focus in the physical aspects and forgetting the other emotional and spiritual elements that are really important and essential, in the well-being of the patient and also the caregivers and the family members, and even for us as a clinicians also. So palliative care definitely has been one of the greatest aspects that allowed us to care people with serious illness since the beginning of the diagnosis until the end of life or to the cure. But we walk with them through the process. So we not only focus in the physical aspects, and I think it's one of the major things, control the symptoms physically, but at the same time paying attention to the emotional, the psychological aspects, and also the spiritual and existential aspects, obviously taking in consideration all the aspects, of the caring of people dying, and obviously ethical aspects of the care for sure. So if we have all these elements together, definitely I believe that we are providing the best care, the best service to our people, especially those who are in suffering, no? And most probably will help us to feel more comfortable with ourselves and helping people, walking through all this process, no? I think that's the most important thing. And it's a great opportunity. I think it's knowing ourselves, and I believe that has helped me a lot to connect with people, because knowing myself, obviously physical, emotional, and spiritual, and allow me myself to grow in many aspects, and also becoming more competent myself in how to provide better spiritual care to our patients, allow me to connect better and help to decrease some of the suffering that is going on. And for sure, for me also to grow, in all these aspects. So it's a process for sure.
Yeah, I guess I'm always reminded of the saying, you cannot cure everyone, but you can comfort everyone.
Absolutely.
Yeah, and I think it's also very humbling when we are faced with diseases that has no cure. It also reminds us how little control we really have over life, and the importance of acknowledging that there is a higher power and that wisdom that we seek every day. I think is humbling and also gives us good perspective. And I'm sure in your field, that's something you face very often, more so than others. So,
Absolutely.
yeah,
It, yeah.
yeah. And why, Dr. Delgado, why is it important for medicine to care for the whole person, like the body, the mind, relationships, the inner life, rather than just focusing on physical symptoms?
We are all connected, and I believe that is obviously as we have our definitely our physical realm that is very important, and we care about these aspects. We have very important elements in our lives, our mind, our soul. Is that there are part of us as a human being, and actually we are not treating illnesses; we are treating people,
Yeah.
people who feels, people who suffers, and and help them and help us to be connected with them in at all levels. That's one of the major things. And the important part, and definitely we will continue to talk about these aspects, is to remember is that we have to acknowledge and recognize that connection, no, physical, emotional, and spiritual. It's all together that makes a person. And whenever any of those are broken, people suffer.
Yeah.
And as you were saying and mentioned, definitely, whenever you face an illness that is, threatening your life, definitely, it's any of those are broken. For sure, obviously, physically, you can broken from anything, liver failure, kidney failure, cancer, any illness that might affect any stability of your physical aspect. But at the same time, the connection and how you deal, how you cope with that, emotionally and spiritual, in also how you relate with the others, how you connect with that. That's kind of we have to pay attention to this aspect, because whenever we forget that aspect, that connection that exists, we really miss a big part of the human care that we have to
Sure.
have.
Yeah, yeah, that's so true.
And just to kind of think about that, and I love definitely the consensus concept about spirituality. It's thanks to Dr. Puchalski and all the big group about spiritual care, is that it's this the spirituality has been defined as the dynamic and intrinsic aspect of the humanity,
Yeah.
that definitely that helps the way the individuals seek and express meaning, purpose, and the way that experience connectedness, no,
Yeah.
with the moment, with the self, with the others, with the nature, with the significant other, with the sacred, with anything that gives you meaning, no.
Yeah.
But remember is that our physical aspect definitely does is us. We have our soul, we have our mind, all connected, no. And so having it setting in that aspect, the connection between our spiritual aspects and the physical aspects, I think we are just one, no. I think we are just a spiritual person since we were conceived. So I think that's important aspect to remember.
Yeah, yeah, I totally agree. And I think that type of care that a physician provides who's aware that a person is so much more than just the physical body tends to be at a deeper level and at a more meaningful level to the individual receiving the care. So thank you for explaining that so nicely. And so, what does research show us about meaning, purpose, hope, influence, how hope influences stress, inflammation, recovery, long term health?
I believe that is very interesting, and you mentioned Dr. Balboni's group work in the many years through all this time about the spirituality and the influence of spirituality in health. And actually, there's very nice article published in JAMA in 22 by this group, very important, where they explore the literature during the last 20 years about the influence of the spirituality in health and spirituality and in serious illness, which is very interesting, and just tell us what is the really role of a spirituality in the person, in per se. Very interesting is that, and there were 8 statements, very important. I was part of this Delphi process that they did, and 8 main items about the importance of spirituality and health, about the frequent attendance to at a service, a religious service, was associated with a lower risk of mortality in general. And I think that is very important. And also, the frequent attendance of this association is like a dose response association. Like the more you attend to a religious, services, the lower the risk of your mortality. Many aspects, definitely better quality of life for sure, less inflammation, less stress, better connection with your people. I think that's important. The other very important thing is that was associated with less smoking, less alcohol, less marijuana, less illicit drugs used, compared with those who attend less to religious aspects. The other very important thing, obviously, there is a better measures of quality of life and even like a better life satisfaction in just general terms in your life. And the other very important thing is that has been said is better mental health. And very important, fewer depressive symptoms, fewer anxiety symptoms, and for sure, fewer suicidal behaviors.
Yeah.
And I think it's about, we talk about all these aspects because obviously it's about your connection, how you connect with yourself, with the others, with anything that gives you meaning, no? And obviously it's in the studies, and we'll continue to talk about this because definitely is many times we don't know what was first, if anxiety and depression and then spiritual distress, or spiritual distress and then anxiety and depression. Definitely they are highly correlated, but for sure it's important to investigate either or how they influence each other. But as I say, it's a better spiritual care, spirituality, attendance to religious services also might be associated with less anxious and depressed mood in general terms. And the other very important thing as an 8th item is that also the effect has been seen in adolescents. Is that the frequent attendance to religious aspects was associated with less risky sexual behaviors, less smoking, less use of marijuana, less use of alcohol, and less use of illicit drugs. Great points, and I believe that that's one of the major things that really allowed us to really say, okay, yeah, so it has a good impact, to be able to participate in the religious aspects if you have it. But if you don't have it, it's fine. But if you have some connection, that's something that helps you to connect, that's important. Something that gives you meaning, that's something important because that's going to be your own spirituality also. And then I believe that it's something important to really remember is that we as a clinician, it's not like we're going to deliver religious care. It's because I'm not the expert also about religion.
Right.
But we're going to provide spiritual care because it's a broader aspects, and we're going to care for the patient as a human, as a person, as a soul, everything all together, no? So many people might feel uncomfortable saying, I'm not dealing with this, I'm not talking about religion, I'm not talking about this. But definitely it's not about that we are talking about that. We are talking about how people use their connections and what they believe and how they are using it to cope with everything that they are going through. So I think those are very important aspects important to feel comfortable deal with that. And that's something that we continue to talk for sure. If you allow me just to share you a little bit more about that. And
Sure.
we talk about the aspects of, yes, so obviously health, the health and and spirituality are very well connected. So help you to feel less distressed and feel more connected and better quality of life in terms of maybe better activities that you do in your life, better connection with the nature, more connection with this, helping others, feeling connected with this. That's spirituality. That's part of life also. But also, whenever we face an illness, a serious illness, an illness that affects our life or threatens our life, definitely the studies have shown that the spirituality really plays a huge role. And people describe it that it's very important for them, at any stage of their illness. And this is very important. Up to 99% of people say, yes, this is very important. And we did a study in our institution, more than 100 cancer patients with advanced illness, advanced cancer patients, and that they place a high role, high importance, the presence of spirituality in their life, and even religious aspects, very important for them. More than 90% of them were saying, yes, it helps us not only to give us comfort and also help us to affront this, to deal better with all these aspects. And I think that's something that we have to acknowledge whenever we're facing these aspects. And we'll continue to talk about this. But the important thing is that all these patients have a lot of spiritual needs. Yeah. And but if we don't ask about it, and if we don't inquire about it, they won't tell us.
Right.
Well, sometimes they might say something, and we don't really, if we are not paying attention to what they say, right, we are not connecting them, and we are not helping them to that. And almost more than 90% of people might have some spiritual needs, how they connected with that. Oh, I've been a good Christian all my life, and now I have this illness. Why is all this happening to me? Yeah. The question of why. And that's why we will continue to talk definitely about how we help people, with all this distress. But the important thing is that people really want to be cared as a whole, in everything, not only physical, but emotional and spiritual. So spiritual care is highly desired for people, but the other important thing to remember, and unfortunately, the studies have shown that as is the patients want the spiritual care to be provided, by the clinical team in general, including the chaplain for sure, but also, the clinicians to acknowledge that part and be part of this spiritual care. Yeah. These spiritual needs are not really covered, and many times they are left alone, and not really, we kind of skip that part, and people continue to suffer, right, even until the end. And that's whenever we see that people, even with a high spirituality or high religious coping strategies, that go through the advanced illness and everything, who do not have any spiritual support at the end of life, might end up dying in the ICU with more aggressive care. Yeah. But contrary, if you provide this spiritual care for people with advanced illness, and help them and accompany with them through the process of dying and everything, they die comfortably, and without aggressive care at the end of life, more acceptance of hospice and everything. So that's very important. And the other important thing is that to remember is that, and that's something that we have to have in mind, is that spirituality definitely plays a huge role in the decision making, how I make decision about my own medical care. And I think those are important things to remember, because it's whenever we face this serious illness, say a cancer, there's a lot of decisions that will need to be taken in considerations also, for sure. It's about, it's continued treatment, my illness continue to be advancing, and what's going to happen, is am I continue with treatment or not? Should I just look for my quality of life and comfort, and looking for that aspect of my care? It's a lot of decisions. And many times, as we have our faith, we have our beliefs, definitely they are very important. Many times we might say, I just leave everything in God's hands, and my religion doesn't allow me to do this, or my religion tells me to do this, and I'm confused now. So people might struggle with that aspect. So helping them to explore and about this and supporting them where they are and how we walk with them through the process is a great thing to do. Obviously, we as a clinicians also, and we'll talk about this also, when people expect for the miracle to happen,
Yeah.
and it's not happening.
Right.
How we continue to support them and work with them through providing that best spiritual care for them also. So, very important, and I think that's something that there's a lot of things that definitely we as a clinicians, and we call it, the clinicians, we are the generalist spiritual care providers, no? Because we are the ones that we are not the experts in spiritual care, but definitely we are the ones who open the door to care more about these aspects. And then the specialist spiritual care comes with the chaplains, no? There are persons who are trained and provide spiritual care in that aspects. And obviously we have our religious leaders in the communities also that are very important to get connected also with us. And I think that's kind of that trio that allowed us to continue to get connected. And I think that will be the beauty about this in terms of how to have a really important and sacred relationship with our patients, for sure.
Yeah, I just love that. Because we do the multi specialty care in so many other respects when we are tapping into other people's efficiencies and I guess their areas of expertise. So I definitely can see, because I did speak to another palliative care physician, and she was also talking about the medical chaplains, about their training. And how, because people, we have to meet them where they're at, like you said. And one of the things I've noticed as a lifestyle medicine physician as well is they did a study looking at providers talking to their patients about lifestyle. And what they noticed is physicians that had their own lifestyle practices, like the ones that were better at following good nutrition, sleep, stress management, exercise, were more likely to talk to their patients about lifestyle practices than physicians who did not do those things. Almost like it made them feel like, oh, if I'm not doing it myself, it doesn't put me in a position to tell somebody else to do it, that kind of mindset. And I've also noticed that with the spiritual aspects, it's usually the physicians that have their own spiritual journey and relationships that they feel more comfortable talking to their patients about the spiritual role in healing when compared to physicians who don't have that type of experience. So that's just something to think about as providers as well. That maybe if you don't have that, then maybe you can have another, like the medical chaplain or someone else, step into that role, especially if it's a patient seeking out spiritual support. So, Dr. Delgado, as far as lifestyle factors go, such as nutrition, movement, sleep, stress management, social connections, how do they interact with a person's sense of meaning and motivation for change?
I believe that it's highly correlated, and is and just going towards what you have said at the beginning in terms of your lifestyle, your connections, and how comfortable you feel talking about these aspects, and also how you can have your own meaning, and just. I feel and I believe that it's very important for us as a clinicians or as a human beings to know ourselves. And this is one of the first steps as having some spiritual care competencies in terms of caring for ourselves, knowing where I am, knowing who I am, knowing what I believe and what helps me to get connected. And that is very important because obviously I know myself. But knowing myself also will allow me to feel more comfortable being able to talk about these aspects. But the other important thing is that many times we are afraid to care for other people in terms of talking about this aspect, because we might open a Pandora box that might be
Yeah.
kind of, wow, I don't know what to do, no?
Yeah.
It's, but I think it's important that even if we don't know about the faith, or we don't share the same faith with our patient, or even if I don't have any faith, for example, that's another important aspect. But I have to recognize that the other person must probably have something that is very important for them. So
Absolutely.
that's why it will be important to open that door, you know, and so we can connect. And so important thing is people cares really. It's not about like I need to be your same religion to be able to provide spiritual
Sure.
care.
Yeah.
It's very important to know that part. But your aspect of kindness, feeling your listening skills,
Yeah.
being present, being compassionate, compassion and presence is very important. That is one of the major steps in the spiritual care. So obviously, and being present and having a non-judgmental attitude really helps you to connect. And believe me, that doing that aspect is the first step of having a good spiritual care, independently if I believe and you don't believe, or I don't believe and you believe, because that's what helps you to connect and everything.
Sure.
So going back again towards okay, so I know myself, I help myself, and I care, and I know that this is my body is my sanctuary, so obviously getting connected in terms of maybe good quality of life, in terms of eating better, doing some exercise, sleeping better, is doing some meditation. I do meditation, I do some writing. I think that helps me to kind of connect again. The writing, especially in terms of just something that comes to my mind, just kind of put it together. I do some painting just to connect, and I think that helps to improve also my own quality of life and my own meaning of life.
Right.
And I love definitely the concept about, obviously, even if you don't have your own religion or your own faith, finding some meaning of your life, that's your spirituality, that's your own way to connect. So helping you with that's important, and that's part of your own well-being and your own spirituality. So I think that definitely that's what's going to continue to help you through the process. Even if you're not ill, if you don't have any illness and you're healthy, finding that meaning and just asking ourselves, what is my meaning at this moment? What is giving me that boost to keep going? What is my passion? What helps me to connect with others? That's another important thing that will really help us to engage with everybody, but especially with us, with ourselves. And I think that's just a matter to keep working and nurturing, cultivating step by step aspects that allow us to continue to grow ourselves, and just going back again, that part in the clinical aspect is that, I don't know many things about, the person, their beliefs, or their own religion or anything like that. But putting my curiosity hat might help me to connect better. Can you tell me a little bit more about what you believe? Is that, or how is this aspect? How is is there any rituals that you love or you like or feel connected with? All those aspects are important because help us is and it's not, you're not doing it in a judgmental aspect. You're just doing it because you're genuinely want to be connected and be present. And many times you just have one opportunity to really connect with your people, because many times the people are very ill, and then maybe the next time they won't be able to even connect. So taking in consideration, taking advantage of that aspect will help you and connect. And I just gonna put you an example is, some time ago I had a patient, and I was in the palliative care unit on call, and this patient had a very advanced cancer. No more treatment for them. It's just gonna focus on his quality of life and everything. Patient with severe back pain because had some fractures there. He was in an opioid pump already, receiving intravenous pain medication, continuous infusion, high doses, very anxious and feeling depressed, and has been taking two antidepressants during the last years, feeling very bad and everything. But when I sat down next to him, and and as we talk about his symptoms and everything, and I say, so how's your spirit? How are you dealing with everything? And he looked at me and he says, I just can't stand this pain. It's horrible. And many times we as a clinician might say, okay, so just increase the dose of the morphine, let's increase of this, or let's do it something. But he most probably wasn't really been talking about the physical aspects, it's and I say, can you tell me a little bit more about that pain? It just feel like it hurts a lot, and I feel like my soul is bleeding, he say. And I'm very graphic, and I just imagine that blood coming down, it's at that moment, obviously, even as a clinician, may respond, oh my God, let's give it some Mariman, let's give it something to calm down this person, no? But you were facing pure suffering there, no? And many times we don't have it, and that's important to say, because we were trying to fix things, and this is not about fixing things. It's about really being present and really being able to walk with this suffering that you're having, and just listen to them. Do not say anything. And then after some moment that he was explaining to me how he was feeling, like his soul was bleeding, I say, can you tell me how we can help you to heal or decrease that suffering, that bleeding, or how we can stop the bleeding that you're having? And so he shared with me, what was happening in his life, what happened in his life, that why he was kind of suffering at this moment, and how we can help, him at that moment. And definitely there was a lot of stuff that we were able to kind of go over many things. And obviously at that time also I sat down, I was present, listened. We did like a live review, some meaning aspects and everything. And it was very interesting how slowly, after even his demeanor changed, his facial aspects, expression changed. I get connected obviously with our chaplains, and also we get connected with his pastor, and all together, and also with the counselor together, continue to talk. And it was amazing that in the next days we were able to decrease the pain medication level to almost half. And he was feeling more comfortable. He was able to connect with his two daughters that apparently had some issues before and everything. And even got to the point that the next week he was able to discharge home with hospice. And he still was alive for 3 weeks more, I believe. The daughters were really grateful. He was peaceful and calm. But it's something that you might say, so what happened? So you can call it miracle, you can call it, it's connection, you can call it healing. So it wasn't about the physical aspect. It must probably help for the physical for sure. But he healed for whatever was happening. It was a lot of stuff for sure. And I think that's kind of the beauty. But if I as a clinician wouldn't have been asked that part, right, or will have ignored that his sign of the bleeding soul, it was some existential aspects of the suffering, I might have just given him some pain medications and some benzodiazepines and calm down, and that's it.
Right.
But this was beyond that part, and I think that's where we can make the difference about all these aspects. It's a young, let's say I just had a very young lady, 40s, her 40s, recent diagnosed with advanced cancer already, hasn't received any treatment yet, is just having a lot of pain, a lot of symptoms, and can't even think about it. And she says, and I ask her, so how's your spirit? And she says, I just feel numb. I don't have anything. So that's it's I don't know what's going to happen with me. It's, the unknown, the uncertainty definitely creates a lot of distress for sure. She had very strong faith. At that moment, even she was struggling, thinking about being a good Christian, being a good person. I don't know why this is happening to me. And I have my 4 kids. What's going to happen with them? Many questions, thousands of questions that we can get at that moment as a clinicians, but it's not our role to answer them. Right. It's our role is to be present and walk with them through the process. So I think that's helped us to connect better with them and walk with the patient through all these aspects. So it's, as I say, we as a clinicians are the ones who can open the door to the spiritual care, to provide a quality of spiritual care to our patients, together with the physical care for sure. And but at the same time, connect with, as you were mentioned, connect with our interdisciplinary team members. And we talk about interdisciplinary because it's not about multidisciplinary. There are multiple disciplines that just work separately, and that's it. We work together. We have our own specialties, but also together, and we become what I call the collective soul. Yeah. The collective soul, because each of us have their own spirituality, their own way to deal with life, their own way to cope. But whenever we have a patient who is suffering, we become one single collective soul to decrease that suffering and improve the quality of life of this patient. So it's a process. So definitely it's a call for all us as a clinicians to really become more competent in giving some spiritual care for our patients, because they need it, and definitely help us to connect for sure.
Yeah, I really love how you spoke about the difference between multi-specialty and interdisciplined aspect, where we all come together using our different expertise, but at the end of the day, to answer some of the causes of suffering in our patients. And just, even as you were talking, I'm looking at that painting behind you. There's so many different colors. And you told me before we started this podcast that you painted that yourself. And it's just, together there are so many colors, so many different strokes, but they make one piece of art. So I think, what you were talking also about, you don't have to have the answer. And I think that's one of the reasons why a lot of clinicians don't even bring up the spiritual aspect with their patients, is because they feel like they don't have the answer. Like we do in medicine, right? Like, I can give you acetaminophen for your fever. I can give you this specific chemotherapy for this type of cancer. And as physicians, we are trained to know the answer to all the problems. And yet also as clinicians, we're also faced every day with certain complexities we don't have the answer to, and being comfortable. And really sometimes the person only wants someone who actually cares. They want to know that you actually care about them. They're not just a problem that you need to solve, but a human, and that human touch of listening and caring, and then bringing in the others because you actually listened, so you know who to bring in next to help that person. So I think that was so nicely put. Dr. Delgado, when there is chronic illness and cure is not possible, which I know you deal with in palliative care, your integrative approach in improving patients' quality of life and patient engagement, I think you already touched upon it a little bit. Can you tell us a little bit more on how that integrative approach helps?
Absolutely. So we work in a team for sure, and I believe that it's important that and it's an interdisciplinary team, as we were talking. No, it's the clinicians that we talk about, physicians, nurses, all the other members of the team in terms of social workers, case managers, and physical therapy, occupational therapists, even music therapy, and art therapy many times, and speech therapy if it is needed also, and also our chaplain. but it has to be like in an orchestra. No, it's just like it's a balance with all these aspects. No, because many times people might feel overwhelmed with too many people
Sure.
at the same time. And patients many times have a lot of needs. And the beauty about the palliative care team is that we cover all most of the aspects of these needs. Now, the physical needs for sure, that many people can do it, and but also definitely not only the pain, but also nausea, vomiting, any GI issues, respiratory issues, sexual issues, financial issues, and cognitive aspects, and definitely all the emotional aspects in terms of anxiety, depression, and financial aspects, caregiver distress for sure, which is very important. It's all the emotion, all the spiritual and existential aspects that are very important. Nobody wants to take, kind of touch it. And so all together, it's and what we do is that we do a comprehensive evaluation in terms of since the beginning. We do like a screening. We use, for example, the Edmonton Symptom Assessment Scale that evaluates symptoms from physical, emotional, and spiritual. And we do a spiritual pain, we do it ask them, do you have a spiritual pain deep in your soul that is not physical? 0 is nothing, 10 is the worst. And then as a screening tool, but there are so many other screening tools that you can ask for to identify some spiritual need or spiritual distress. And then obviously comes the clinician, we, either the nurse practitioner and the physician, also the nurses, to do the general story, including the spiritual history. Very important. We use the FICA created by the group of Dr. Puhalski, is in terms of what faith, what is the importance, what is the community, what is the approach, in general terms, how important this is for you, how this is influence your decision making, etc. So very important that we try that all of our clinicians do it. As a generalist, we care and we provide that spiritual history, because that's one of the first steps, as I say, of providing spiritual care. And then as we made some diagnosis in terms of, yes, there's a presence of the spiritual distress, or emotional and spiritual distress all together, or total pain, as we call it, is, everything physical, emotional, and spiritual and existential distress all together. That's when we obviously we have our interventions medically, it's either pharmacological, non-pharmacologically, but also at the same time we have our counselors, with our psychologists that are important, and for sure our chaplains also. And also some in the other intervention in terms of integrated medicine, if it is needed, so meditation, acupuncture, or meditation, some other like music therapy, art therapy, very important also. And so all those aspects are connected, and I believe that really helps to the spirit of the person. But the other important thing is to remember is that, and as we were talking, is that we are the generalist spiritual care providers. No? So even, for example, our social worker, our case manager will touch those aspects as a generalist. Our counselor for sure will touch those aspects, not as a chaplain, but definitely will touch it, because they are highly connected with what people express in terms of emotions and everything. So, and the same with the chaplain also, we'll touch about that. And it will be very interesting and lovely, because, the chaplain can tell you, obviously will help with the emotional and the spiritual aspects, but at the same time say, hey, doctor, by the way, the patient hasn't gone to the restroom in 3 days. Kind of, so that's pure transdisciplinarity, obviously, because everybody knows their own role, but at the same time is aware of different other aspects that affect the patients. Sure. And that really creates an environment where people, we cover the needs of the patients, in general terms. And the other very important thing is, as a team, we get connected. We get really connected in the aspects of, let's say I have a very hard day. It was a lot of distress, a lot of patience, and suffering and everything. And or I have some discussion, hard times and everything. But also, I will be able and feel comfortable to talk with somebody in my team about it and give me that support. That's a great thing. It's chaplains also play a huge role, for example, in decrease some of the moral distress that some of the nurses might have and some other clinicians might have, and we all support each other, and I think that's another beautiful thing to do it. So it's a balance, no? And but working as a team, obviously have their own challenge, but it's a beautiful thing, definitely, because as I say, we become one collective soul to really to try to decrease that suffering of the patients.
Yeah, that's beautiful. So, for the sake of time, Dr. Delgado, can you tell us a little bit about healthcare as it becomes, more technical? We are integrating a lot more AI, machine learning. How can integrative and lifestyle medicine help preserve that compassion, meaning, and that human touch in patient care?
It's a great point. I believe that is as we continue to go through all these advances and everything, we just need to remember that we are human beings, and that we have our own needs, and obviously we have to care about ourselves, no? And remember that our body is our sanctuary, and at the same time, that sanctuary has the mind and the spirit, no? And so caring about ourselves in many aspects, obviously physically, have some time for yourself, kind of time out some time for yourself. I think that is important. you know Journey connections, if you have some aspects about spiritual connections are important. If you have your own faith and your own religion and you participate and be engaged with that. I think live that aspect. I think it's important. And if you don't have it, specifically religion, just what gives you meaning and continue to get connected. And I think that's another important aspect that will really help you to connect. And the other important thing is to remember is that, and as we think about, how we create a healing environment, and I think about all these aspects, is because we want to create a healing environment for our patients, but this definitely needs to be applied for ourselves. So it's an environment where we need to have a commitment. Definitely creating a culture of safety, a safety for us and obviously for our patients, but also an area of communication, a culture of openness, obviously with our patients and where we are living, but also with ourselves, with our family, with our loved ones, where we connect, where we care. And also an attachment, a culture of belonging, to feel something that is ours, or feel that we belong to something that allowed us to get connected. And also an agency, a culture of empowerment, to be able, obviously, as we care for our patients, to help them to have autonomy and help them with, to make decisions and everything and create better goals of care in general terms. But at the same time, for us, that empowerment to express ourselves, to be able to kind of say, okay, yes, I'm agree, I'm not agree. I feel like I need to do this. It's kind of be able to grow in many aspects. And the other very important thing I always say is that our involvement in inclusion, because everybody is a person. We need to include everybody, and that inclusivity and that you care for everybody, no matter your beliefs, no matter your sexual aspects, no matter what. We are all humans, so definitely that um, respecting that diversity and that integration, that inclusivity, definitely that's very important for us. And the other important thing is that just feel like we don't need to fix everything. No, have that therapeutic humility, that will really help us not only to deal with patients, but also to deal with our own lives. So caring for ourselves, I think, is important, and to walk through the process.
Yeah. Thank you so much, Dr. Delgado. So as we close today's conversation, let us just remind ourselves that true healing, it often reaches beyond just medication or addressing a physical ailment. So while science and clinical care are very crucial, they're not the whole story. And as Dr. Delgado very beautifully put several times in his discussion on this topic, that people find their deepest healing when physical care is accompanied by faith, by sometimes just listening, by showing that we truly care about the other person. It's a human touch. And then there's also prayer, there's relationship with God that plays a very important role in acknowledging, especially when it's important to the patient, that we also want to support them in that journey. So thanks to everyone for joining us on Time to Transform. I hope this conversation encourages us to care for not just our patients, but also for ourselves. And if you are a caregiver for someone who is having a chronic illness, be intentional in taking care of yourself. Because just like the airplane analogy of, put on your own oxygen mask before you put it on for someone else, it also plays well for us to remember that taking care of ourselves make us better caretakers. So let us seek support through community. And if prayer is an important part, do engage in that. Draw closer to God, because God is the ultimate source of our healing, strength, and our peace. So before we conclude, Dr. Delgado, would you like to say a prayer for our audience and for caretakers and physicians who could be listening to this podcast?
Sure, absolutely. Thank you. And I just invite you to have a moment of put yourself in the present moment. Let's take a deep breath. One more time. One more time. As we give thanks for life, we give thanks for allowing us to share this moment. We give thanks for many things in our lives, for our loved ones, for our family, for our friends. We give thanks for health. We give thanks for allowing us to touch souls who are suffering and try to help them to walk through the process. We give thanks for each moment of interactions. We give thanks for each moment of healing process. We give thanks for us, for our well-being, and for our loved ones. In your many names, amen.
Amen. Thank you, Dr. Delgado, again, for your time, your expertise, and sharing all your experiences with us. We hope to have you in future episodes.
Thank you very much for the invitation. It was great to be here with you and everybody. And to Megabe with you all. Thank you.